My name is Sarah, and I want you to see me and see NF.
My name is CJ. I want you to see me and CNF.
When I was 10 years old, my mom was brushing my hair one day and noticed a bump on my head.
I was diagnosed when I was 6 months old, dealing with NF throughout my whole life.
And when I was younger, they kind of said, oh, she might have NF, she might have something similar to that, because I did have the cafe au lait spots, challenges walking.
Well, I've been in a wheelchair for about 3 years now.
But it wasn't confirmed until I was 10 after my tumor was removed, to which it was found cancerous.
And then high school, I had to actually leave after 9th grade because of my walking deteriorating.
And since 2009, I have been cancer-free, which I'm very grateful for.
I think it might be easier compared to other people where you can't see their tumors. For me, people can see my wheelchair, they can see the tumor, so people might say, oh, do you need help more? Or I might get more accommodations.
I remember kind of just reading about the expectations and whatnot of this disease, and I was waiting for that to happen to me, and it's okay that it's not happened to me, or it might happen, and I'm fine with that.
If you don't look like you have a disability, but you really do, people might make assumptions that you're just wanting stuff just to want it, or you don't really need it.
When you look at me, I have neurofibromatosis, but I'm a preschool teacher. I'm a college graduate. I'm a daughter.
I go to Rowan University, and my major is computer engineering.
And it's really powerful to see other people who are using their voice to show that though they have all this challenges in their life, there's so much more than that.
I like everything that other teenagers like watching YouTube or playing video games. Yeah, I like comedy. That's what I watch on YouTube, comedy stuff.
I'm just very grateful for all the milestones that are coming for people who are more affected with NF, even though I don't qualify for anything within that. It's just amazing to see the strides. Even 10 years ago when I was first diagnosed, there wasn't much. And I'm excited to see what the future holds in 10, 20 years, because I know eventually there will be a cure for this disease. But right now, even though I'm idly waiting by for the next chapter, I'm just excited to see what's going to come next. My name is Sarah, and I want you to see me and see NF.
My name is CJ. I want you to see me and CNF.
Good morning, everybody. Thank you so much. It's my honor to be here today to talk about skin findings in neurofibromatosis. I'm from University of Minnesota, and I often work with our famous Dr. Mortel and collaborate with him. And also, I'll say that while this destination does cause some heart palpitations for a dermatologist, it's been great to see you guys out at the pool with your full sun protection, and you know how to pick a nice location. I've been to my fair share of conferences at the O'Hare Airport Hotel, so 2 thumbs up to this. I also want to especially welcome our families here today, and especially those of you that brought children with or have children with NF. I'll say that I have a daughter who's 11 years old now, and she has a rare genetic disease, not NF, so I'm used to day-to-day being in a space where sometimes it feels like there's more questions than answers, but also know how great it is to have a community to help support you. So thanks for being here today. Also feel free at any point to interrupt me. I know there were a ton of questions on the Whova app, and I've read through those and will help to address those as I go through, but if there's other things that are prompted by this talk, just raise your hand and let me know. Today I'm going to start by talking about skin features of NF as well as treatments for those things. I'm going to talk a little bit about some of the skin reactions to our emerging therapies for NF, and I do want to save time for questions. Okay. This is my home, So I work at our beautiful Masonic Children's Hospital, but I have a background in internal medicine as well, and so I often follow our adult NF patients once they graduate during that transition time. And those are my excellent colleagues, Dr. McGinnis, Nicholson, and Polcari, and some of you may actually see them at our hospital too. A lot of times, my NF patients come to me because they don't yet have a diagnosis. And many of you may have also been seen by a dermatologist initially for the skin changes of NF before you ever were diagnosed. I'm going to talk about some of the more common skin findings NF, but also talk about some of the less common skin findings that can be a clue, especially early on. As you guys are probably well aware, 3 out of the 7 diagnostic criteria for neurofibromatosis 1 rests in skin findings. So a lot of times, dermatologists are the first ones to make these diagnoses. I see a lot of children that are referred into me having 1 or 2 cafe au lait spots or maybe some bumps on the skin. And the question for us as dermatologists is, does my child have NF? What do I do about it? And a lot of times children don't meet that initial clinical criteria, and it takes some time for them to develop more cutaneous features that lead us in the right direction. And it's hard to know what to do when someone doesn't meet those criteria right away. These are the skin findings of NF that I'll talk about today. So cafe au lait spots, skin fold freckling, neurofibromas, plexiform neurofibromas. But I also want to touch on some of the less common things that you may have seen on your own skin or your children's skin that could equally be associated with NF. We know that the skin findings in NF are predictable but variable. And so everybody with NF is unique, even parents versus children who have the same mutation, they may have very different skin findings. We know that for most people, if they're going to have a plexiform neurofibroma, that would be something that they're born with, even though we may not see that right away. The second thing that tends to come up really early on are the cafe au lait macules or patches, so the light-colored spots on the skin. And oftentimes babies with NF are born with those, but other times they show up in the first year of life. The next thing that we tend to see would be the skin fold freckling, as well as a little bit later, those neurofibromas. I had a lot of questions in the Whova app about cafe au lait macules and patches, so I'll talk about those for a minute, but if other people have questions that I don't answer, please raise your hand and let me know. So these are the tan-colored spots that show up, and they can be there right away in infancy and early childhood. And a lot of different genetic conditions are associated with cafe au lait macules. Some of the things that we're looking for that would be unique to neurofibromatosis would be that these spots tend to have these nice, really smooth borders instead of jagged borders. And the stats are a little different depending on what article you read, but by age 1, up to 99% of people with NF1 will have 6 or more cafe au lait spots in those patients. The good news is that these are benign and they do not ever turn into skin cancer, so not something to be worried about from a medical perspective. People tend to accumulate these during childhood and into adulthood. They tend to start to slowly fade a little bit later in life. When that happens is unique to everybody, but typically beyond the childbearing years, sort of into the 40s, the 50s, the 60s, we do tend to see them lighten. In our little ones, they grow with the child, and they are spots that may get darker in the sun. Again, we see these in the general population, and just because someone has cafe au lait spots, it doesn't mean that they have NF. You can see this little baby that was born with multiple cafe au lait patches, and then you can see the nice smooth borders on these spots. And I will mention that a lot of times in our patients with more darkly pigmented skin, these go unnoticed, unfortunately, for longer than our children with more lightly colored skin, so can result in a bit of a delayed diagnosis. Okay, a lot of questions about treatment for these, and we don't have a lot of great answers yet. They can be really cosmetically bothersome, and if that's the case, certainly laser treatment would be an option, and lasers the technology is really rapidly progressing. That is the great news. There's 2 different types of lasers that we would use, and you may have heard of these, the ND-GAG or Alexandrite laser. And lasers for medical use are different based on what they're targeting. So for instance, for people who have what we call port wine stains on their face, we'd use a laser that targets the color red. For cafe au lait spots, we're targeting the color brown or black, so that pigment in the skin. The problem that I'll mention with that is, first of all, the lasers work much better if there's a big contrast between the color of the spot and the skin tone. So people who do have more pigment to their skin may not get as good of a clearance with the laser compared to people who have lighter skin and a bigger contrast between the color of that cafe au lait patch and their background skin tone. The other thing to mention is that the lasers release a lot of energy in the form of heat as we're treating these. And so that tends to be the complication of the laser. We can get some blistering with lasers that can lead to scarring, as well as dyspigmentation, so either darker or lighter pigmentation with these lasers. You probably pass, many malls that have cosmetic centers where you can get laser treatment, and this would not be a time where I would opt to save money. I think that it would be a good indication to go to see a medical dermatologist who has good training and experience with laser. The downside to the laser treatments is that they're expensive and they are just not covered by insurance. Even in patients with NF, they are not, I have never seen them covered by insurance. And so typically you would buy a package of multiple treatments, and that could go, from $1,000 to $3,000 or $5,000. The other thing about the laser treatment is it doesn't always last forever. So you may pay the money to undergo the laser treatment just to have those spots become a little bit darker again later in time. And there are some things that you can do to prevent that from happening, but it still is a risk. And that's why, first of all, I would never think about doing this in a child, because of the fact that when they really start to care about this, perhaps during their teen years or early 20s, they may experience redarkening of the cafe au lait patches. And these lasers are painful, and a lot of kids would not tolerate them. And so to put them through something like this, if they weren't very bothered by the cafe au laits, may not be a good plan. We do know that sun plays a role in the darkening of the cafe au lait spots. So being really careful with sun protection can be helpful to make them less noticeable. We would recommend that you use a sunscreen that's SPF 30 or higher, and really strongly prefer the zinc or titanium-based sunscreens for a lot of reasons. We know that our chemical-based sunscreens, we've found some unfortunate byproducts in some of those, so we know that the zinc and titanium are much safer, and those also block all wavelengths of light instead of just some. And so they're much more effective. For patients who have darker skin tones who really hate the mineral-based sunscreens because they leave a white cast to the skin, there's some really nice new products that have a bit of tint to them, so they don't have that same white discoloration of the skin. I have had patients with NF who ask me about bleaching creams, wanting to use bleaching creams, and these are readily available on the internet and some marketplaces, but they won't be helpful for the cafe au lait spots, and in addition, they can paradoxically darken the skin, so we wouldn't recommend those. Any other questions about cafe au lait spots?
So with the sunscreen, would one I have right now in my room has aloe vera in it. Is that a good choice for people with NF? And do you really like the spray or the cream with NF? Which one is better?
Yeah, those are great questions. And so the question was, is it good to have a sunscreen that includes aloe vera? Is that correct? Yeah, so in dermatology, we're not a huge fan of plants, even though plants might be considered natural. The skin doesn't always like plants, and I use poison ivy as an example for this. It's very organic, but can cause some bad rashes. And so people can become allergic to plants over time, but if it's something you're tolerating, I certainly have no objection to it. The bigger thing is, what are those active ingredients in the sunscreen? So do we have ingredients that are mineral-based, the zinc and titanium? And that would be what I would look for. The other question was about sunscreen sprays. From our perspective, we also have some challenges with those. It is really hard to get the SPF that's on the label of a sunscreen spray in practice, because you'd have to apply it at least 2 times in a really thick spray. We also don't know with those what the risk is for inhalation, and a lot of those are chemical based. For an adult, I feel better about it because you reliably can hold your breath. For our little ones, oh my goodness, like if I asked my 5-year-old to hold his breath while I was spraying him, that just wouldn't happen. So the sprays contain chemical sunscreens mostly instead of the mineral. There are now some mineral-based sprays, so I'd look for those if you prefer the sprays.
In veterinary medicine, we use lasers too, but we don't use them on animals with tumors because it encourages cell growth. Is that a concern with lasers for people with NF?
What kind of lasers are you using?
Totally blanking right now. I do
Yeah,
know.
that's okay. There's so many different types, but these are just very superficial. They only target the very top layer of skin, so I wouldn't have concern about these specific cosmetic lasers causing tumor growth.
I've been told that where the cafe au lait spot is, that a neurofibroma can grow there. Is that true?
It can happen, but a lot of people develop lots of cafe au laits that do not grow neurofibromas within them. So it is not a for sure or always, or even usually.
Many times people are confusing laser with electrodesiccation, and I'm sure you're coming up on that later when you're talking about the cutaneous removal.
That is correct, and lasers have been used for the neurofibromas as well. But I'll talk about that in a minute. And I'll take one more question.
Okay, I have very hypersensitive skin, especially on my face. I can tolerate most sunblocks on my arms, on my legs, chest, anywhere below the chin. So what I've been using for sun protection on my face is I wear an old-fashioned prairie bonnet. Think Lauren Goes Wilder. Is that a good option for keeping the sun and protecting me? Because, well, obviously, I'm a redhead, so I'm even more susceptible to skin damage.
That is a great choice, and that feeds in really nicely to my talk about other ways to protect ourselves from the sun. But we think about sunscreen as a final option for sun protection instead of the first option. So I'll talk a little bit more about that in a second. Okay, so skin fold freckling, sometimes called crow's sign, and you might read in textbooks that this happens in the armpits, but it can happen in any skin fold. This is another really common feature in our patients with NF, and 90% of patients will have this by age 7. Usually it's not too bothersome, and we don't recommend treating it. It would probably respond similarly as a cafe au lait spot would, though. Okay. So this is the other big topic that people had a lot of questions about. So neurofibromas. These are benign growths of a certain type of neural cell within the skin. For most patients, the cutaneous or superficial ones start after age 8, but I have seen younger children with them. And about 60% of adults with NF1 will make neurofibromas. This table shows a classification of the different types of neurofibromas because I think this can be really confusing. We have our skin neurofibromas, and those are the cutaneous ones, the bumps that we can see. And then we have our subcutaneous, which are often referred to as plexiform. And those are the ones that we can still feel in the skin and may have some increased hair over them or color change. And then we have our deep neurofibromas, and these are the ones that can really cause more problems. So the visceral in the organs, in the spine, or around the eye. And those are the ones where people may need more systemic treatment for. Okay. So with our superficial neurofibromas, They become more common during 2 time periods. We see them crop up more during adolescence, the teen years, and pregnancy. We know they actually contain hormone receptors for both progesterone and estrogen, which helps to explain that a little bit. They are really filled with these mast cells. Dr. Mortel talked about that a bit yesterday, so they can release histamine and be very itchy. They, I would say that the risk of the superficial ones for cancer transformation is so exceptionally low. You can find case reports of this, and I sometimes wonder in reading those, were they truly dealing with cutaneous or were they more looking at plexiform? But they have a huge impact on quality of life as well as self-image, particularly when they're in visible areas. So something that oftentimes people ask about treating. The deep or plexiform neurofibromas, about a quarter of patients with NF1 will make these, and these are actually associated with risk, even though it's a low risk of transformation to malignant peripheral nerve sheath tumor. And symptoms would include increased size, growing rapidly, and some increased pain. They like to form on the back region, and they are actually more common in people with less of the other skin things. So people who don't have a lot of cafe au laits or may have absolutely no cutaneous neurofibromas, which is interesting. We'll talk about some of the treatments for these coming up. Thinking about how can we treat neurofibromas, it's really challenging. There have been a lot of studies looking at how the best way to treat these would be. Probably our gold standard is still going to be removal of some type that's surgical. So we used to really only have excision to do this. And what this would be like a skin surgery. Your doctor would numb up the area and we'd make a little ellipse around it. And so what ellipse is, it's sort of like a football shape, and we have to extend that incision quite a bit beyond the outside of the lesion, because you might imagine if we just remove something in a circle and tried to sew it together, we're going to have some puckering at the sides. And so what that means with this technique is that even though we might be removing something that's only an inch long, your scar might be 3 or 4 inches long. And so you're trading a bump for a longer scar. So that's not necessarily a great trait. I'll talk about a new technique in a minute for removing these. The other ways that we've used over time to try to eliminate the cutaneous neurofibromas, the destructive methods, that would be things like electrodesiccation, where we numb up the bumps and then remove them, do a shave removal, and then actually sort of burn the base to prevent bleeding. The carbon dioxide laser, and that delivers a ton of energy that just vaporizes water in them to kill the skin. And then also there's been some just other forms of laser, like the erbium laser, to do some photocoagulation. And basically, these can have a huge variety of outcomes. And so for some patients, they feel like it's a really great outcome. These photos are of pictures of people who have had the carbon dioxide laser in particular. And so again, you are basically trading your neurofibroma for a scar. And depending on how you make scars, this may be a good or bad trade. For some people, they make really thick scars that can increase in size over time, like a keloid. Some people, if they have dark skin, they still may make scars that are more lightly pigmented, and so we have this speckled or polka dot effect, which may not be preferable. So it's a bit unpredictable how each person's body will form these scars. One thing that I would think about if you're contemplating having any kind of laser treatment for the neurofibromas would be ask your doctor for a test spot. Don't have them do 200 spots the first time. See how your skin is going to heal. See how it's going to heal in different areas. So maybe do one spot on the chest, one on the back, one on the arm. See what it looks like on your skin tone before you embark on treating a bunch of them. As far as other things, you may have read about injectable things like diclofenac or ketotifen. There's also been some creams, imiquimod. None of these have had really great results, and so it may be a lot of effort without a lot of positive response. And so there's not a really great topical, oral, or injectable treatment to shrink down the cutaneous neurofibromas at this point in time. Okay. This is a technique that I've been using a lot in clinic that I have seen some really nice results with. And so instead of doing that big elliptical excision that I was talking about, we just numb up the bump. And sorry if this is kind of some gross pictures for people here. I just wanted to show what this looks like. So we would numb up the bump, and then we would shave the surface of just the bump off, and that sort of rubbery material underneath pops through that hole, and then we can remove that, and that's that neurofibroma underneath the skin. And then we just sew up that little spot. And so instead of having a big long scar, we just have a scar that's the same size as the neurofibroma was to begin with. The nice thing about this is much smaller scar size, really low risk of recurrence or any kind of complications. You can do multiple removals at a time. I still usually would only do about 5 at a time just because I don't want people to be sore all over, having trouble finding a comfy position to sleep. But really good quality of life outcome measures. This is best done when the spots are less than an inch or a couple centimeters in size. It turns out much better. And these are some before and after photos from the journal article that this was published on, so you can see different areas of the body. C was just a breast picture, so I covered that. But you can see really nice healing for a lot of these spots, even some of the larger ones. And so this is a really easy technique to learn. If you have a dermatologist that you see, even if you gave them this reference, they would very easily be able to figure out how to do this. So just writing down this journal article and passing this off to your dermatologist and say, hey, do you think we could try this next time I want a couple of my neurofibromas removed? I teach all of our residents how to do this. It's really quick. You can remove one in less than 2 to 5 minutes, so really nice technique. What questions about treatment of neurofibromas? I think we have what do they call it? Modified shave excision technique. You could do either. Usually I will do an interrupted top stitch on it. If you have trouble with top stitches and just want to do a subcutaneous stitch, like a plastic surgery stitch, that would be possible too. For bigger ones, I would probably put in some deep stitches and some top stitches, but for the little ones, just tops. I don't think I know that data. Is there a specific published article on that? I can look at it and put it in the HUVA app. Okay. Are you aware of topical mechs for? Yeah, Inflection Therapeutics. Yeah. Okay. Okay, I will take a look at it and put my thoughts in the HUVA app. I know that our systemic mechs haven't done a great job, but it sounds like if they're publishing it, they probably have some good results.
And we're passing the mic around. Yeah. Oh, okay. Yeah, we're captioning this, so all the questions have to be on the mic. So if you can just wait. Thank you. All right. Here.
Hi. Good morning. I've read conflicting data on this. This is not on removal of neurofibromas, but this is about neurofibromas specifically. Is there or is there not a correlation between the number of neurofibromas and the vitamin D levels of the individual? Yeah. I've read 2 different things that conflict.
Sure. So I did look up this information yesterday, and there was one research paper done a good number of years ago, probably about 5 to 10 years ago, that was a retrospective study, meaning looking back at data that they had already, so a little less reliable than a study looking forward. And they did find that people with lower levels of vitamin D did have more cutaneous neurofibromas. But again, is that causation versus association? They said that more data needed to be collected, but then I didn't see a subsequent study that really gave us that data. So it could mean the study was done and it didn't have a positive outcome, or it just hasn't been done.
I think one of the findings was that it's possible that people with more neurofibromas cover themselves up more so they get less direct sun exposure. That's one of the theories. But, or is it, again, as you said, causation versus, okay, yeah. Thank you.
Yeah, exactly. So I think it would be worth exploring, but we don't know yet.
Hi, so like my son has one on his stomach, And it does have the cafe au lait around it, but he does have the neurofibro in there. And it's starting to grow hairs. Should we be worried that about that could be cancerous?
No, I would think about, is he going into his teen years, or how old is he? 23. And did it start growing hairs kind of during puberty, or was it before that? Okay. Yeah, growing hairs is not a worrisome sign in and of itself. It sounds like, I do wonder if he has a plexiform neurofibroma underneath, so one of those deeper ones. And again, those would have a low risk of malignant potential if it was growing rapidly or becoming painful. I would consider further imaging of that, or just at least having his primary doctor or his NF doctor take a look at it, but the hairs alone wouldn't be worrisome.
Excuse me, how often does the numbing thing for the one where you shave, how much does the numbing agent have an allergic reaction?
That is very low. And so I am a dermatologist. I do biopsies every day, all day, and I have never seen anyone have an allergic reaction to the numbing agent. It is possible, but uncommon.
And how advisable is it for someone with NF to have a tattoo?
I don't think I want to get into that one. I think you should have a great talk with your parents about that. I see no medical contraindication to it, though, I will say. All right.
Hi. I have vitiligo, and about the same time the NF started to manifest itself, a few months later, I got vitiligo. And I know way back when there was no research, but recently I heard that there's research common between people who have vitiligo and also have NF.
I am unaware of that. I can investigate that. Certainly we see people with NF, first of all, have skin, and so they're able to get any type of skin thing that people with NF don't have. So I don't know if the vitiligo is related or not, but I'll look and see if I can find a paper on that and post it on Whova.
Hi, I'm Tracy over here. Just got a quick question. My sons have had two NF, the cutaneous removed, one from a scalp and then from the nose. Our doctor at a hospital referred us to the plastic surgeon, and I had one time was going to have a dermatologist do this, and then I said, oh, it was on the face, I'll go to him. He did say that he felt that, and you could answer this, but he felt that doesn't matter where it is, because sometimes if it's certain doctors, like I know you're experienced in this, but there are some dermatologists that really aren't experienced on NF, that it's best to have the surgeon who is, so that, because it can affect nerves, and a certain dermatologist wouldn't know that, and that they could cause more damage. Do you feel that's maybe just do our homework and make sure that if it is a dermatologist, they really are aware of what NF is and what it means?
So if they're removing just cutaneous neurofibromas, I don't think you're going to run into too much trouble with associated complications of injuring nerves. And so any dermatologist should be able to handle that. If it was something larger like a plexiform neurofibroma, then for sure I would have a surgeon remove that and likely need some imaging ahead of time to kind of be sure that we know what structures this is involving, or is it wrapping around other, vital structures. As far as who to have do it, I think it's just who feels comfortable and confident doing it. There are specifically trained dermatologic surgeons that are very competent, that could remove any neurofibroma anywhere. If you don't have someone like that, plastic surgeon would be great. Again, the difference is a lot of times dermatologists will do things awake, whereas more of our surgeons, at least in our area, put kids to sleep for most procedures. Pros and cons to both approaches depending on the age of the child.
We mentioned a little bit about electrodesiccation. Mm-hmm. I had that done, and I had about 400, I call it zapped, on my face, my neck, and my chest. And I did have a little bit of a complication of an allergic reaction to the bacitracin. Oh. If anybody wants to see the picture, I've got it right here. And so I did break out in black scabs. But you know what? They healed after a time. and most of the bumps never came back. But as expected, some are, coming up slightly. So, and then there was also, if you go onto the NF boards, the NF Facebook boards, there's a big discussion on whether or not insurance will pay for it. Sometimes even with those new codes, some surgeons will not accept it, and some insurance companies will not accept it. So just be care of that, everybody.
Yeah, those are great points. I would say that we always would want to do a prior authorization before embarking on this. Different insurances, even in different states, would have quite variable coverage. And I would agree that some people do extremely well with all of these removal techniques. I just would hate for someone to be in a situation where their healing was poor and they've had 400 spots done and don't know it until after the fact. So, so just things to keep in mind. Okay, and one more?
So to elaborate on that tattoo question, my daughter, who's 22, has a plexiform neurofibroma on her ankle. It is pretty deep, but it's been ultrasounded, imaged, it's no problems, stable. She's had it since she was she was a baby. It's not a problem at all. Is a tattoo okay on a plexiform neurofibroma?
You have so many areas other than the plexiform to tattoo, I would pick a different spot.
Okay.
Yeah,
Thank you.
I wouldn't want to do, plexiforms are hard enough to tell if they're having any kind of transformation, so I wouldn't want to do anything that could cause additional edema or swelling or infection or anything else that could complicate that question.
Perfect.
Yeah. Okay, I'm going to talk about a few less common skin findings, and these are things that you might have seen in your kids or yourself that you've been curious about, but juvenile xanthogranulomas, so some pink yellow bumps on the skin that we see early on in life. These tend to fade away by early childhood. Again, something that's not diagnostic for neurofibromatosis, but if I see a baby who has multiple cafe au laits plus this, I would certainly have a higher level of suspicion. The thing that we worry about with this is that there's a rare triple association between the JXGs or the xanthogranulomas and a certain type of leukemia that we see in patients with NF1. This isn't something we'd necessarily screen for, but just something to be aware of if we have kids that have both things together. Anemus anemicus. These are white patches that some of you may have, and they like to really focus on the upper chest or the neck. They are spots that, when the rest of your skin gets pink or hot because of dilated blood vessels, these just stay white. They have blood vessels that just don't dilate, and up to 15% of people with NF have these. Neurovascular stain. So some of you, particularly on the legs, may notice these kind of red or purple patches that are a bit mottled and have some lighter colors surrounding them. They're made up of neural tissue and blood vessels. Again, they're not dangerous, but they are related to NF. I'm going to take a minute to talk about sun protection in NF because some studies have showed that people with NF have a higher rate of melanoma, which is our most worrisome form of skin cancer. Because our data is really limited, we take this quite seriously until I think we have a little bit more data to either rule this in or rule this out. But in these studies, these patients had about 4 times increased risk of melanoma, and they tended to get diagnosed a little bit later when the melanoma was more progressive. So we do recommend skin checks for our patients with neurofibromatosis and really great sun protective practices for everybody in the room. These are my partner Ingrid's 2 little twin girls doing a good job with their sun protection on the beach. But sun protection is a great way to reduce risk, kind of like a preventative thing, wearing a seatbelt or a helmet. Number one thing I want to say is avoiding tanning beds. So the wavelengths of light in tanning beds are carcinogenic, even more so than the sunlight. So just stay out of tanning beds. Even a couple times use greatly increases melanoma risk. Say applying sunscreen every 2 hours when we're outdoors. A lot of us are great at remembering to put it on in the morning in our makeup or whatever else when we first get to the pool, but really that reapplication that's super important. It wears off after about 2 hours and sooner if you're swimming. Again, choosing our physical blockers with zinc or titanium, and as our one friend was saying, wearing great hats. And so finding hats that really wrap all the way around. So not just a baseball hat, because those are only effective when the sun is shining right straight overhead. It's shielding our face, but still the sun can get in on the sides. So nice broad brimmed hat that goes around. Sun protective clothing like swim shirts, sunglasses to protect our eyes, and then seeking shade. So instead of picking the chairs by the sunniest part of the pool, usually there's an area in the shade where nobody is sitting, so take those chairs. Those are gonna be the best, the safest. Okay. I'm gonna take a few minutes to talk about some of our emerging treatments for NF1 and the skin findings that we see related to those. So we reviewed the MAP kinase pathway yesterday, that in some of our growths and tumors associated with NF, we have just too many cells proliferating, getting too many growth signals by this MAP kinase pathway. And so some of the newer drugs, including from our sponsors here today, our MEK inhibitors, really help to stop the progression of these cells from dividing. But unfortunately, we know that they also cause a lot of skin side effects. And so skin reactions are some of the most common side effects that we see in both kids and adults who have NF who are on these treatments. Most people who develop skin reactions to these drugs have multiple skin reactions, and the most common are an acneiform eruption, which is an acne-like eruption that loves to go on the middle of the face, the chest, the back, really dry, itchy skin, and then subsequent skin infections, folliculitis, growths around the nails that are painful, rashes on the hands and feet, and even some hair changes. We know these reactions really differ by the age of the person who's taking the MEK inhibitor. So our little ones will have more problems with eczema and dry skin, whereas our teenagers and adults will get more of those acne-like eruptions. And everybody can get dermatitis, which is skin inflammation that tends to be itchy. Okay. And unfortunately, these skin reactions are one of the most common causes for people to stop their MEK inhibitors. So even if the MEK inhibitors are working to shrink the tumors, people want to stop these drugs because they just are so bothered by the skin reactions. So how can we prevent those reactions from happening in the first place? So thinking about dermatitis and dry skin, for our patients that we see starting MEK inhibitors, we really encourage things that help get more water in the skin and get rid of irritants. So we used to say, oh my gosh, if you have dry skin, don't ever take a bath. We know now that more bathing is actually better for dry skin. So a daily bath or shower if possible with a really gentle soap. I have some examples listed here. Not scrubbing, so getting rid of those things like loofahs and harsh washcloths. We don't want to get all of the natural oil off the skin. Knowing that, again, organic and natural does not mean that it's hypoallergenic, so some of those really plant-based materials can cause a lot of skin irritation. And then right away after you get out of the bath or shower, moisturizing. If you were gonna take a shower every day and not moisturize, you'd end up with more dry skin. We see that in our kids in the summer who are in and out of the pool all summer, they dry out. But putting on a moisturizer and choosing something thick that comes in a jar is a good rule of thumb. So if it's a lotion with a pump and you truly have dry skin, it's gonna be too thin. It also will contain a lot more preservatives and alcohols for those thinner lotions. So a good rule of thumb would be choosing something in a jar. For something natural, I would recommend coconut oil, just the kind that you buy at the grocery store. But otherwise, I have a few examples listed here of ones that we commonly recommend. And then common things that, are basically in every Walgreens and Target, wet wipes, these makeup remover wipes, these are really irritating to our skin and contain lots of preservatives and chemicals that people can be allergic to over time. We wouldn't recommend those. And avoiding things with fragrance, and again, avoiding things like scrubs or exfoliants. Our skin doesn't like those things and they're not helpful. For patients who do get a lot of dry skin and dermatitis, this sounds completely ridiculous, but we love to recommend our swimming pool baths, which are really just dilute bleach baths. These can easily be made at home by mixing some plain but not splashless bleach with water, and we'd say about half a cup to half tub of water. The benefit of this, just like regular pool water, is that you're not taking an oral antibiotic, you're not putting an antibiotic on your skin, but it still does a good job of killing some of that bacteria that likes to cause skin infections in our patients who are on MEK inhibitors. Also is anti-inflammatory, so it downregulates inflammation in the skin, even apart from helping with the bacteria. If you have a doctor who's helping you, they may also prescribe some prescription shampoos or some topical cortisones for some of these dry, itchy rashes. Our acneiform eruptions, again, we see these more in our teens and adults on MEK. They start the first few weeks of treatment, and even though they look like acne, they're just inflammation. And so they're things that treat acne we would want to avoid because they make more irritation. Our treatments are going to be oral or topical antibiotics, and sometimes topical cortisones can also help calm these down. The nail inflammation called paronychia. These are these really painful and often oozing bumps around the nails. So avoiding trauma, cutting our nails straight across, and again, doing some antimicrobial soaps to help prevent our infections, lots of Vaseline, and we have all sorts of things we do to try to treat these in clinic with topical steroids or antibiotics or something called silver nitrate that can just help to get rid of some of that extra tissue that forms. So what I would say is if you are on a MEK inhibitor and you are really struggling with your skin to the point where you're like, oh my gosh, this is so not worth it, I want to stop my MEK inhibitor because I'm miserable, please, if you don't already have a dermatologist, ask your NF doctor to refer you to someone, particularly someone who has seen these MEK-induced reactions. There's so many things that we can do to make these better, and we never want this to be a reason for stopping your treatment. Okay, so key points, the skin findings in NF vary hugely between individuals. There are treatments available. We'd want you to go see someone who has some expertise in NF if you're thinking about something surgical or invasive. Sun protection is super important for everyone in the room for lots of reasons, but particularly that increased skin cancer risk. Skin reactions to MEK inhibitors are very common, but there's lots of ways that we can prevent and treat them. And mostly thank you so much for inviting me to talk today. It's been my pleasure to be here, and I'll take more questions.
We have time for like one more question.
Okay. And I'll also stay during the break if people have questions then.
So you say with the gentle soaps, will goat's milk soap work as well?
Well, what was the question? Goat's milk?
Yeah.
Yeah, I think that, again, if your skin does not react to it and you are doing well with it, then it would be safe for you, and I think you could continue that. Okay. All right. Thank you so much.